So today, Shinar and I are going to be talking about patients suffering with fibromyalgia, some strengthening and exercise programs to help maintain this condition. As we all know, fibromyalgia is a chronic condition with widespread pain displeasure, followed with stiffness, poor sleep patterns, and fatigue. As Shinar and I researched further into detail, we wanted to learn some exercise for patients with fibromyalgia, so we could teach them to you to help in outreach and further in your program. Basically, there is no cure for fibromyalgia. We're strictly going to explain and talk about ways to maintain this condition, starting with aerobic exercises and strengthening of the muscles.
Why are we doing this, Maddie?
Well, we are doing this to maintain circulation by getting blood flow to your muscles, because if you are not active on a daily basis, then your muscles do not get as much blood, therefore decreasing the muscle movements and increasing achy pain and tightness. We are also doing this to decrease anxiety and depression and increase energy levels. A common therapy exercise for clients suffering with fibromyalgia would be pool therapy. This is a type of aerobic exercise that decreases stress on your joints and targets specifically the muscle groups to help strengthen them as well as relax others. The warmth of the pool can also contribute to relaxing the muscle groups and act as a soothing modality. A study done in Spain showed people who participated in water aerobics improved their quality of life long-term and decreased depression. To achieve a goal with physical and mental well-being, clients should maintain exercises in the pool for 60 minutes at least 3 times a week. So now what I'm going to be doing is I'm going to be demonstrating with Shinara some exercises you should be doing in the pool if you're suffering with fibromyalgia. And remember, you can check online for your community, to find specific pools that help with fibromyalgia. They have programs, right? Okay, so what I'm going to do is we're going to start off with a 1-minute warm-up by walking around in the pool in the shallow end, progressively going into a tread for 2 minutes in the deep end. After treading the water for 2 minutes, you then want to start doing exercises, and these exercises would be a donkey kick, so with 10 on each leg. And remember to always do low impact. If there is pain, never push through the pain because you don't want to overexhaust yourself. And keep a good form. After the donkey kicks, there are the flutter kicks. So I'm going to pretend to be a wall because we don't have a pool wall right here. So on the pool wall, Shinar is holding on to it and doing flutter kicks. You want to flutter kick for at least 15 to 20 seconds. After flutter kicks, Shinar will be doing some lunges in the shallow end of the pool. Keep proper form with your knee not passing your toe. Should be doing 10 on each side. After lunges, she would be doing squats. So 10 squats. After doing the exercises, your client would then be doing a cool down, which includes walking around the pool for another 5 minutes. Okay, and remember, you should be doing your exercises at the time of day you feel you have the most energy, because people suffering with fibromyalgia have highs and lows of energy throughout the day. Thank you.
The second part we would like to encourage our clients with fibro to do would be a walking program with different levels of intensity. We came up with a walking program that you can try with your clients. For the first week, we'll be walking a total of 10 minutes. The first 5 minutes would be your warm-up, so you'd be doing some regular pace walking. The next 5 minutes would be a more brisk pace, a higher intensity level of walking. You would want to be walking so that your heart rate is elevated, but not so much that you are gasping for air. While walking, try to think about your posture. Keep your head high, looking forward, keeping your core tight, and keeping your shoulders back and relaxed. During your walk, be sure to stay well hydrated with some water. And at the end of your 10 minutes, finish with some stretches to cool down and prevent injury. A few stretches we might suggest could be upper traps. So for this first one, we would be doing contralateral rotation to the side that you're stretching. We'd be doing some ipsilateral rotation and flexing the neck forward. We'd be holding this stretch for 30 seconds and doing it on both sides. The next stretch we'd like to do would be hamstrings. So you'd want to do a gentle toe touch for this one. You'd be bending forward, reaching for your toes, and gently stretching for 30 seconds. The next stretch we could suggest to you would be quads. So you'd want to grab a wall or something that you could hold onto for some support, and you would flex the knee and grab the ankle, and you would provide a gentle stretch for around 30 seconds to the quads. The next stretch we're going to be doing is for gastrocs. So we would be placing the foot against the wall and flexing forward and holding this for 30 seconds, feeling that stretch along the back of the calf. Every single stretch we're doing should be held 30 seconds to a minute and be performed as part of your cool down to your walking program. Every week you would progressively add 5 to 10 minutes until you reach a total of 60 minutes. And remember, before prescribing any fitness routine to your client, ensure that they talk to their doctor if they have any health concerns around it. Remember to encourage your clients to stay active. This could be as simple as walking to go get their mail, playing with their kids, or taking their dog for a walk. There's no right or wrong way to form a fitness plan for a client with fibromyalgia. We are simply getting you started and showing you some exercises that you can prescribe to help them with their individual symptoms. It is up to you to assess the individual needs of your client and look at their fitness goals and activity levels to see where they're at. You need to tailor the exercises that you prescribe to their own individual abilities. No one experiences fibromyalgia the same, and so no two fitness routines should be the same. Some questions that we're going to provide for you to think about would be, do you think it's possible to maintain and continue being active with a chronic pain syndrome like fibromyalgia, and why? What are 5 questions you could ask your client to determine their activity level when making a fitness plan for them? Do you think that exercise for fibromyalgia clients can result in overall well-being and mood change? If so, why do you think this? Thank you.